what are the options for TRT, and as many pros and cons of each as you can give in a short time? I know, like, I think Dr. Glaucomflecken, we had him on here, Will Flannery.
Oh, yes.
I think he has like some kind of gel or something, or he had a gel at one point. So, but he has daughters. So
Yes, yes. So transdermals or topicals, which are going to be your gels, most commonly is either Testim or Androgel or Auxilium. These are going to be gels that you apply daily. They have to be applied daily. They can go anywhere on the back, the shoulder, thigh, or abdomen, depending on the different formulations, because they have different specifications on like which body part to apply the gel. But most commonly, it's your shoulders, back, thigh, or abdomen. The important thing is that, the dosing is anywhere from, depending on what you use, if like Axiron, if it's a pump or if it's the packets of gel, anywhere from 40 milligrams to 120 milligrams every day. Now, it's very important the application of this, because you need to wash your hands before you apply this. You should apply it to clean, dry skin, and you want to make sure that it is completely dry before you get your clothes on, which is typically 5 to 10 minutes that you need to let it dry. If you don't do that, you're going to be at increased risk for transference, which is one of the biggest side effects of the gels. Transference actually means that it can be absorbed by your clothing and can be in contact with someone else, like a female partner or young grandkids or children that are running around, and it can actually mess up their hormonal axis and be absorbed into their system. We actually have published literature on, young female babies that develop clitoromegaly because their dad was on testosterone gel and didn't realize, and it was transferring to the child. So there really is a real and significant risk of transference with these medications. It's skin irritation for some patients. Cost may be a factor for some patients. The benefit to a gel is that it's rapid onset. It's out of your system in the 24 hours after you put it on, and it's pretty easy to use. But I'm not a huge fan of gels, just because most people don't take the time to put it on correctly, and you really worry about that risk of transference. And there's, so many of us, right, that either have young kids ourselves or you're around grandchildren and such not. So I think that that's really important. There's also a transdermal patch that's called Androderm. It's 2 milligram or 4 milligram patches. That's another topical thing you can use. You can put it on daily. The problem with these is, and most of my patients, I've never had a patient stay on it more than a year, is because you get these dermatographic irritations. So you get rashes and you have to move it each day. So you have these little red blotches that are all over your skin. So, I guess the benefit is that it's, again, easy to use and it's something you apply daily, but you really get those rashes and those irritations from having to move it so much. There is an intranasal gel called Natesto, and this is kind of one of the newer things on the market. Natesto ranges in dosing from twice daily to 3 times daily. I think they've now changed the guidelines where you can use it twice daily instead of 3 times. And it's a great option for patients that, and have no problem doing nasal gel into their nares. And it's also been shown in some literature that this is one of the very few exogenous testosterone therapies that will not impact spermatogenesis. And the thought behind that is that, you kind of have these higher peaks and troughs of testosterone levels during the day by administering it nasally, intranasally. And so it doesn't impact fertility the same. But again, the benefits to this would be, a rapid onset. It's not something that you have to apply daily on your arm or your body. So it decreases that transference risk, that it possibly preserves fertility. But, the disadvantages is that it can still impact fertility. There are some published papers that it did impact fertility in some men. You get a lot of nasal irritation, burning or runny nose, and some patients will complain of altered taste or smell. We have injectables, which we kind of talked about briefly already. You have your short acting and you have your long acting. Your short acting are going to be, again, that testosterone cypionate or testosterone enanthiolate. Typically, again, you want to apply this weekly. Most of the time you start at like 100 milligrams a week. You can certainly, some people go up to 200 milligrams weekly. The benefits to this is, you have a really good compliance. You can get it fairly cheap. It's something that you do just once a week, you think about. But again, disadvantages for patients that maybe are needle phobic and very uncomfortable. If you're not doing it weekly, you can have that high variability in your testosterone levels where you get a high peak and a low trough. Some patients will say that, injections tend to have higher rates of polycythemia, or that elevated hematocrit levels that we have to work on. And then if someone, maybe they have dexterity issues, right? Like they're not able to use a needle to inject well. And then just kind of briefly, the long-acting testosterone would be like testosterone undecanoate or Avede. And this is a every 10-week injection that you need to get done in the office, as opposed to these short-acting ones that you do at home, with yourself at home. Avede is something that must be done in the office. It's 750 milligrams intramuscular of testosterone. When you first come in, you get one injection in the office, and then 4 weeks later, you get a second injection, and then it's every 10 weeks. The benefits to this is that some patients will have a little longer compliance, because you have to think about it just every 10 weeks. It's a long-term or long-acting testosterone therapy. But side effects or disadvantages is you can get POEM, or pulmonary oil microembolism, with this. That's where you kind of get into this coughing fit after you inject the testosterone. Shortly thereafter, you get into this coughing fit. So us as providers and clinicians, we actually need to, part of the recommendations when you prescribe this to someone is you have to keep them in the office for about 30 minutes after you administer this to make sure that they don't have that and that they tolerate the medication well. Some people will also say that you can get higher rates of hematocrit, again, that polycythemia, and then insurance coverage doesn't cover it for all patients. And you can still, again, get these variable levels. And a lot of patients can be hypogonadal before they're due for their 10-week shot. And you can't get this shot too early or insurance won't cover it. So that's just kind of some other ones. Now, there's also a short-acting Xiosted, which can come in these auto-injectors for people that are very uncomfortable or nervous with needles. So those are all kind of injectables. Another option is subcutaneous pellets, and that's called Testipel. And that's where you have these small pellets of 75 milligrams testosterone, and you inject it once every 12 weeks, or at least that is how I administer it in my own office. So the dosing, you can go anywhere from 6 pellets up to 12 pellets on patients. You dose titrate it based on their first. But it's an office-based procedure where patients come into the office, and every 12 weeks we perform this procedure. I numb them. They get a little numbing shot, and we put it kind of in the upper outer quadrant of the buttocks area. It's a subcutaneous, so it is not in the muscle. It's in the subcutaneous tissue. And then they come back every 12 weeks to get another Testipel. The benefit to this is that, again, it's something you're one and done. You think about it 4 times a year, every 12 weeks, and you're good to go. It's long acting. It gives you really nice, consistent testosterone levels. I tend to have my patients get what's called a peak and a trough level. So 2 weeks after insertion of Testipel and 10 weeks after, and then that's how I titrate them. And most of the time when I get that peak and that trough, I see that there's really only about a 200 fluctuation, from maybe 900 to 700 or 700 to 500. So you don't get a huge fluctuation in that as well. Now, the side effects or disadvantages is that it is an office-based procedure. You could get an infection. Anytime you make an incision on the skin, you could get an infection. Making sure that insurance covers it. Depending on how long you're on this modality, you develop scar tissue or have little scar marks from where you have the insertion of the Testipel. And again, you may have some expulsion. Sometimes pellets can come out. It's not common, but it can certainly happen. So that's really kind of the main different types of your injectables. But luckily now we also have oral therapies, and I kind of mentioned those earlier. One of them is Clomid that we already kind of talked about and mentioned, but there's also an oral buccal called Striant. It's basically a pellet. It's 30 milligrams. You take it twice a day, and you just kind of put it up here in the buccal or the gum area. And it's rapid onset. It's very easy to use, but you can still get that gum or mouth irritation where you're putting it. And some people will also complain of altered taste with this, and insurance isn't covering it with everyone. And then now we also have these newer oral testosterone therapies that are actual testosterone, unlike Clomid, which, as I mentioned earlier, is that selective estrogen receptor modulator that's great for preserving fertility in men and stimulating your own natural testosterone. But oral exogenous testosterone modalities are anything from Jatenzo, Tilando, or Kaisertrex. And these are typically done orally twice a day, different dosing depending on which oral medication. They're very easy to use, right? It's just a pill you remember to take in the morning. You get rapid onset of this. But a lot of the side effects here is that you may, again, have some GI side effects. You can have headache. It really needs to be taken, twice a day. So making sure that someone remembers to take their medication, and increased hematocrit levels, polycythemia, or increased blood pressure, and checking that with patients. So those are really kind of the biggest ones. And as I'd mentioned, we had already talked about Clomid and HCG, which can also be used to increase testosterone levels. But I didn't talk about the dosing. Clomid is typically 25 to 50 milligrams that you take every other day. You can increase it to daily to increase someone's natural testosterone levels. And then HCG is typically, it's an injection. So again, for patients that are needle phobic, this may not be a great option, but it's anywhere from 500 IU every other day to 10,000. But it is an injection that you do to help increase testosterone levels. Benefits is that it does preserve fertility and it can maintain your testicular size. So some people will see physicians that prescribe testosterone therapy with HCG to patients that are worried about testicular atrophy. But again, side effects, you can be irritable, you can have injection site pain. It's not always covered by most insurance companies, and it can be very expensive, ranging anywhere from $100 to $400 a month.
We've mentioned
That's really, I'm leaving out one last one for completeness. There's aromatase inhibitors, kind of how we talked about when patients, if you have a lot of obesity in your fat tissue, we have aromatase that converts testosterone to estrogen. Well, we have oral medications that are also aromatase inhibitors, like anastrozole or letrozole. And these are usually weekly, and they help basically block the conversion of testosterone to estrogen levels, which thereby increase your testosterone levels.